Hi, welcome to Law and Justice. I'm Jane Mulcahy. This is a special series on the topic of relationships matter, and today I am really excited and thrilled to be joined by Harry Zeit. Hi Harry, how are you?
I'm good. It's a pleasure to be here with you.
That's great. I'm very delighted, as I say, that we're connecting and you're over in Canada, so there's a time difference that we had to negotiate around, but it's wonderful to have you here, Harry. Before I get into the topic, and we're going to talk about many things, hopefully, including trauma and attachment and therapy and the body and medicine in a general sense, can you tell me a bit about yourself, please?
Sure. And I think it's a good place to start because I really didn't come to trauma for many years. So I was born and I've lived in Toronto my whole life. But even saying that from the very get-go, even though I grew up in the suburbs and they were quite calm and peaceful place, I always had a larger sense of myself connected to the world. So in my early years, I did a lot of traveling. I wrote. I was more of an explorer. And I remember in high school, I was thinking about the interview. We had this sort of cool hippie math teacher, Mr.
Right.
Meslin. And I went to him and I said, I don't know, when I was a little kid, I wanted to be a doctor, but I've also wanted to write. And he said to me, well, you can, go into medicine and always write, but you can't be a writer and practice medicine. And I did get into medical school actually quite quickly, which surprised me, but the mysterious process. And I worked for 22 years as full-time in emergency medicine. I had my American boards, was certified in that as a specialty. And then, well, moved on to psychotherapy, which is why I'm here today. I'm sure partly. Yeah.
Yeah, yeah, but I
Yeah.
was very excited when I went onto your website and saw that you were 22 years in emergency medicine because that brings huge expertise of the body and, accidents and traumas of a particular kind, but that are not necessarily the same as the trauma that we might delve into a little bit. Um, on the medical training side of things, Harry, and I know you're going back, a fair while to talk about your medical training, but what level of focus was there on this phrase psychological trauma and whether that also then had an embodied component to it and involved overwhelm of the person's capacity to cope? Like, did you get any training on that, or was it extensive or none?
I think we got zero training on
Uh-huh.
that, and I think we were taught how not to live in our bodies and how to ignore trauma, if anything. I'm
Right.
remembering one of my teachers in clinical clerkship, which what we call our senior year of medical school, and he was a neurosurgeon, and he hated psychiatrists, and he
Yeah,
was like, they don't have a stroke, they're not real.
right.
And there was a lot of that environment, but certainly nothing at all in the curriculum. Psychological trauma was never mentioned once.
Hmm. And do you
Yeah.
know, has that changed, Harry? Like, would young medical students and nurses now, or even psychiatrists as well, would they be bringing the body and the brain and the mind together more, do you think? Or do you know?
Well, more from zero is more. I, I have to share a story. I actually learned about PTSD I was at an emergency medicine conference in British Columbia. And, you have keynotes and conferences, and then you have optional workshops. And I went to one, and it was taught by a vet who, as a hobby, was studying injuries in the Korean War. And he
Wow.
noticed that a lot of the people at had frostbite and severe frostbite injuries, also developed psychological symptoms. I, but to go on, well, I feel so gifted because 5 years ago I was given a lecture at McMaster University on trauma. So I get an hour and 15 minutes, which kind of still floors a lot of people in the field that
Yeah.
they're saying, what a progressive university, because most universities don't have anything. But I do feel hopeful in the sense that I think I see younger psychiatrists and MDs, a subgroup of them, but a group none the same, that are really involved in social determinants of health and an interest in trauma, structural oppression, and
Yeah.
so forth.
Yeah, that's great, and we'll talk a bit more about that in a little while, I think. So you were 22 years in the emergency room, which I imagine was very hectic and stressful and all go of a particular kind. What made you then decide to shift and become a psychotherapist?
Well, it was also wonderful and amazing as well, especially in the early years. And I still miss a sense of community. I keep in
Okay.
touch with a lot of people. Those experiences do stay for a lifetime, the connections we make. But at the same time, it's terrible to compare to now when things are much worse. But even going back to the early 2000s when I was winding down, I was impacted, I think, as someone who's fairly sensitive and who started working in a way I could uh, offer care at a certain level. It would drip by drip, year by year. There was less and less of the capacity to provide that care and
Hmm.
to see what couldn't be done, which could be done. It took its toll on me, and it took its toll in subtle ways.
Hmm.
But, I really, ER is not a lifelong career. And I think
Right.
many of us in the field knew deep down. And so the problem with emergency medicine is it does catch up with you, but there's no real path out of it in
Okay.
medicine. So I think other people navigated differently. Some people more gracefully. Some people never really got out. Some people stay in far too long. But I would happen to go through some pretty profound personal changes, which kind of guided me, or we guided each other out of emergency medicine.
Yeah, thanks, Harry. And can I ask you, did you find at a particular point that maybe with the pressures of the system, and I think this has probably become worse everywhere, certainly since COVID, where there was overwhelm within the system to try and respond to this massive crisis. But even probably before that, there's only so much money, so much time. Were you feeling a bit out of step with your own values then, maybe in the quality of care or just the systemic pressures? Did that take its own particular type of toll?
It did take a toll, and definitely just, as the system began to be affected, there are little things like I work with really good nurses who, if the child came in and they needed suturing, the nurses would be able to go and calm them down and stay in the room. By
Hmm.
the end, especially in the city, I was working in two hospitals, one more urban, uh, hardcore ER, and the other more community. But in the urban center, the nurses wouldn't even be in the room while we sutured, and
Okay.
or if they were, the kids would be held down. And little things we could do, like I remember early in my career, things like, I remember a young mom coming in and saying, "Please do something, or I'm going to hurt my child." And
Wow.
in those early years, one of the nurses sat with them. We admitted mom to medical bed. We admitted her child to pediatrics.
Okay.
And there wasn't any psychiatric expertise or any psychotherapy expertise, but the system supported in those very simple ways that,
Hmm.
aren't really studied or evidence-based. And those sort of things could, by the end, they just wouldn't happen because there were so many things were managed and
Yeah.
protocolized. Yeah.
And looking back, I mean, that's a very interesting story that you just told there, but can you recollect interactions with patients in the ER that were suggestive of maybe the fact that some of their medical symptoms or even episodes, for example, suicide attempts or drug overdoses or violent encounters on the street, perhaps, that might have led them there, that they could have been somehow linked to childhood trauma or even later life trauma, because it can accumulate, of course, over the years.
I look back now and I see things so clearly.
Right.
And at the time, I think more intuitively or even somatically, I just felt something was off. Why some people were so mistrustful,
Mm-hmm.
why some people, when we made a kind offer, like, you can stay overnight, it's okay, and we'll get whatever needed to be done, and they'll go no, or I did understand, and I was understanding, and people appreciated it. If someone needed a smoke, that other staff would be going, no, no, if you
Yeah.
go to smoke, you have to go home.
Yeah.
Go have a cigarette, don't listen to them, I'll let you back
Yeah.
in that. But it now looking back, just so many things that I saw that, the bodies that were twisted into collapse,
Mm.
this that sort of terror and violence that went together, so many
Yeah.
of the chronic illnesses and that. But I didn't have a name for it then. I just
Sure.
had a feeling about it.
Yeah, gut instinct. Yeah, which we ignore a lot as well, because we're I think as rational beings taught to trust our minds and our thoughts rather than these feelings, and what they might be trying to nudge us towards. But even the smoking examples are so interesting, because smoking, according to the ACE studies, is hugely linked to the accumulation of adversities in childhood. And if you've a chronically dysregulated nervous system, you might want to self-soothe by a chain smoking, which is then not allowed inside the hospital, certainly, but or being a heart patient and not having the good sense to realize that you shouldn't be smoking. But really, again, it's not so much a rational choice at that level. And we can be very judging, I think, in some of our responses. And of course, it is bad for the health too. So then, as a practitioner now with this expertise in human physiology, but also in the mind, how how would you describe or define trauma, Harry?
So this question that comes so often, and I think of this word that's been meant to carry so much that it's got to the point where I don't think it can any longer carry all the things. Trauma is unique, and it's a collection of snowflakes. So yes, there is a traumatic event which overwhelms our ability to integrate that experience. So, if you're coming out the birth canal and forceps are put in your head and you have no nervous system, or you have a nervous system and nothing else, it's going to be a much different experience than if you're someone that's in war or in a concentration camp or in a car accident. Someone who has an experience of profound terror is going to be different than someone whose trauma is more around betrayal.
Mm-hmm.
So my hope is that I understand trauma overwhelms our ability to integrate wherever we are and whatever our resources and past experience and protective environment is. That trauma, when we talk about it, is not the event, but what it leaves behind.
Mm-hmm.
And it does affect us on every level, from our cellular biology to our social comfort, a lack of comfort, to our spirituality. But it's very hard to use one word to describe
Yeah.
many, many different pictures. And I think we get very confused because then we conflate it with post-traumatic stress disorder, which is a very specific diagnosis, which really covers very little of
Mm-hmm.
the what trauma does. And then we can get very moralistic about trauma, and this person shouldn't feel this way because
Yeah.
they didn't this happen. But in fact, if we begin to be curious about everybody's experience and who they are in the moment, sort of interacted with what the environment threw at them, we have a more accurate picture.
Yeah, that's so interesting. And it all makes sense to me because I suppose I've had conversations with people who've drawn attention to different aspects of it. I even did holotropic breathwork course based around actually the birth related trauma that can exist. And for example, I was a forceps delivery. There's quite a lot of instrumental births out there now. I knew it all the time from when I was small that there was a forceps involved, but I would never have for a second thought it could have any impact whatsoever. Or even the fact that just being born in and of itself is, a struggle for the nervous system. Do you think doctors and would most psychotherapists now be quite aware of the fact that there can be traumas associated with being born, quite separate then from the later attachment related trauma that can occur after birth? Harry.
I'm wondering, I never used that example before of trauma, so I'm wondering if in the field between you and I that using forceps as an example just came.
Okay.
And then, one thing I've learned as a psychotherapist is that you really do create a field, and some things that are not explainable happen. And that I think, yes, there is growing awareness in the field about transmission of intergenerational trauma, about how trauma can happen during birth.
Mm-hmm.
And of course, Stan Groff, who was the originator of holotropic breathwork, wrote a great deal about it. But the field is very big, and it's a very fractious field.
Yeah.
And it's not a field where there's a great deal of consensus. I think we all find our way into fields that support what we do.
Yeah.
But the problem is that once you start looking at what can happen post-conception, during birth, then you start to ask the questions, well, what do you do with that?
Yes.
And that asks a lot of some models or some short-term therapies. So, many people, I think, just because we don't like to feel that we're not doing enough, will rationalize, oh, that doesn't matter, and that's the past, and we're here to find solutions to the present. But certainly, I've done enough long-term work to find the work goes where it goes, and it will keep getting deeper. And often that comes to catastrophic events in the first year of life or even in birth.
Yeah, no, it's fascinating to me really, because I think an awful lot of people as well, including people who are doing quite well. They've lived good lives. They've gone to school. They've gone to college. They've qualified. They've a lot of money. Maybe they have a family, but perhaps something is vaguely amiss. They may not go to therapy, but if they were to have found out even about some complication in the birth process, they would never put two and two together, or even be capable of getting their heads around how something that they've no memory of could have any lingering impact, because pre-verbal trauma they'd have no kind of awareness of it. And again, because medical training might not in a screening process ask every question, that there could be to ask a human being about. And for example, the social determinants of health and movements like Black Lives Matter, these are very significant issues, and colonialism and decolonizing mental health, or decolonizing health systems, I'm reading quite a bit about now. But do you, Harry, in your practice, or just from being a human being in general, think that racial and cultural violence and oppression are specific types of embodied trauma? And again, are they adequately recognized as that if they are types of trauma?
So there's a lot of layers of that question. And it's
Hmm.
certainly a question that, again, is bringing a lot of awareness, but with that turmoil and conflict within the field. I remember as a medical student, I did an elective in New Orleans. I spent a
Okay.
month at Charity Hospital, and I'd be in these clinics and cardiac clinic with all the patients were Black or or the vast majority of
Hmm.
them. And it wasn't a terrible hospital. It was actually a good hospital, but you could see and that the rates of younger people were coming in with heart disease or hypertension than I was seeing in a more Eastern and Western European or
Hmm.
Canadian population back home. And I wasn't working with Canadian Indigenous people where I would have seen the same thing in
Okay.
diabetes. So, I mean, there's no doubt that there are a lot of impacts with adversity, with ongoing what people call
Mm.
microaggressions, that they impact again on physiology, on identity. They create sort of chronic adaptations, which, um, you know, they don't come off as glamorous.
Hmm.
And, that's often the harder thing about traumas that, you know, people will say, well, they're not behaving properly.
Yeah.
We expect people that have had a lot of trauma to be nice and just come in and say, please help me. I've had a hard life. But,
Yeah.
people come in and they can be more appeasing or more distrustful or more aggressive. So very difficult right now because this awareness is coming. It's coming to a system where, to a certain degree, the system is traumatized and the people working in the system
Yeah.
are traumatized.
Yeah.
And then it's asking another layer for people that, if things weren't hard enough, you have to recognize that, your people you're treating have more trauma than you imagined and more pain. And we want you to show up for them.
Yeah. Yeah, it is
Yeah.
quite an ask at this moment
Yeah.
in time. That's true for
Yeah.
healthcare professionals, given what they've been through. I'll ask you a little bit more about that in relation to self-care in a moment, Harry, if that's
Okay.
okay. But while we're still talking about trauma, on your website you mentioned that you practice or are qualified in sensorimotor psychotherapy. Can you tell me a little bit about what that is, please?
So sensorimotor psychotherapy is one of the newer thematic models of therapy that's sort of well set up for trauma. It's created by a woman, Pat Ogden, who lives in Boulder, Colorado, who worked for a long time with Ron Kurtz, who was the founder of Hakomi, which is very mindfulness, body-based psychotherapy. And they took some of their work out of the early body psychotherapies. So one of the nice things about sensorimotor psychotherapy is it's working through the body. So you're
Okay.
going to pick up all those pre-verbal implicit, call it,
Hmm.
coming from the subcortical or unconscious parts of the brain and work with them. So often we're seeing things that get missed in traditional therapy, such as people come in and they've been in talk therapy for a long time, and we pick up that they're in a freeze response. So, of
Hmm.
course, everything that they talk about is I'm paralyzed, I can't move forward. And the somatic trauma therapies like sensorimotor or somatic experience and give us a chance to clear that. And often when we clear that, the thought process had changed naturally. So when in my website it says I'm certified, it means I did all three levels, which was
Okay.
quite intensive.
Yeah.
I don't know if I do that final level over again. It was quite, it demanded a lot of
Okay.
us all. And sometimes the smaller therapies, do want to prove themselves in a very political landscape with a lot of competition. but
Hmm.
there are 3 levels, and I did do them all, and then I hung around and did a lot of training assisting. And
Okay.
definitely I'm very grateful for all the things it's given me personally and as a therapist as well.
So would it be something that you would use frequently enough with people that you're working with?
Yes, it informs everything I do. So
Okay.
I I may only touch on it, but in a funny way, I look at bodies. I was laughing with a colleague. I was at a retreat with some colleagues the other day. It was quite nice to be
Mm.
back in person. I said, here I am looking at, who has life in their body and whose, pelvis is, frozen, or whose breath, freezes, and who is just alive. And,
It's
you know,
such an amazing question, really, because just from the whole COVID experience, I felt one, I think I might have had long COVID, but two, a lot of my body felt quite stiff and frozen in a way that it never had before. And so this idea that we are energy, that our energy needs to flow in a healthy, free, and joyful way really makes sense to me, having experienced this not pleasant at all experience um, brought on by the COVID experience, and possibly the imprisonment as well, of not really being able to move in the way in the world with the sense of safety that we previously had. So that's fascinating that you can look at a body and kind of see things or pick up even when people are not necessarily coming for therapy, Harry.
Yeah, and the field has advanced so much. For instance, we talk about something called the cell danger response, which probably involved in long COVID,
Mm-hmm.
many chronic autoimmune illnesses. I'm going to say chronic fatigue. That's our North American. You
Yeah.
say ME or fibromyalgia, where especially in people with a history of childhood trauma, uh, in the face of threat, the body overreacts and stores that memory, and anything vaguely like that threat, it responds in the same way. And the cell danger response means that we shut down and stop making energy in the mitochondria, which are these little
Mm.
organelles in the cells. And I was hearing a talk by Eric Gordon, who's an integrative physician recently, and he's talking about we even see that locally. So in people that have parts of the body frozen by trauma, so say you've had sexual
Mm.
abuse, and you may be very open-hearted, but your core and your pelvis are quite shut down.
Yeah.
You might see, for instance, in that population, we'll see a lot of endometriosis
Right.
in that, where the physiology may not be altered in here and here, but it's altered in other places in the body. So,
Mm. Yeah, fascinating. And I did polyvagal theory training with Stephen Porges before
mhm.
lockdown. And one of the most interesting things he said about shutdown was that is what happens when the body obviously experience a kind of life threat and can't escape it, but also that it often manifests in problems below the diaphragm, which of course would
Yeah.
make sense there in sexual violence and not being able to run away and not being able to speak about it, maybe, or to even admit that it happened or remember that it happened. So again, the case for medics to have this awareness and knowledge is actually so important, isn't it, Harry? Really, to find out some of the origins, or even to conduct research as well, to make stronger links rather than having things just be anecdotes, maybe.
And it's come so slowly, the awareness in medicine. I remember when I started talking about polyvagal, and it's going back in time 11, 12 years ago. And it had been around for a long time. We're talking about the ACEs study.
Mm.
And literally people would walk out of the room and just get very angry, and, and which shines a whole other light on medical culture. But I think people
Yeah.
are starting to take that in.
Yeah.
a little more. Because why should it be threatening? Why should new knowledge be threatening? You know, you think that medicine should be, you know, a field where we're constantly open, embracing new information. But there, you know, our own trauma creates that more siege mentality. Like,
Yeah.
don't tell us we're doing wrong. We can't take
Yeah.
one more thing. Please leave us alone and let us know we're great.
That's it. I suppose there could be a guilt and shame as well for not responding optimally. But when you don't have access to the information, how can you do better? It's somewhat more frustrating when people are presented with the knowledge and awareness and the scientific facts, and then willfully go into denial. But as you say, that in itself is a trauma response that can be linked to the traumas within the field and within the system as well. Can I ask you in your psychotherapeutic practice, Harry, about safety and attachment? Are they, do you think, important in terms of the success of the therapeutic process?
I think absolutely. I mean, for some people, you know, they've had a good history and they won't need it, but we should always provide it. I think it really is foundational and it should be our first expectation of every therapy. You know, I compare it. I think actually Adam Burley said the same thing, but in emergency medicine, we always said do the airway first. Like even if someone came in and you know they have the terrible broken leg and the bone is sticking out and they look like they were breathing fine, we always assess the airway. And they say, you know, when they teach about therapy, that we always start with safety. The problem is that people get very cognitive about it, and you know it's very important that people feel safe, but it's for the most part people know they're safe. That trauma survivors or people with trauma, they go, I know I'm safe, but I don't feel safe. I hear that over and over
Yeah.
again. So the question is, how do we create a sense of safety that's taken in at a autonomic nervous system level where the body can relax with that? And, you know, in the same way, how do we create the conditions of attachment so it's not cognitive, it's more a felt sense of feeling like the therapist is somebody that could be somewhat of a secure base, you know, that, and it gets more complicated because, you know, sometimes people can't tolerate too much too nice too quickly.
Yeah.
And in a way, you know, one of the most delicate things about long-term therapy is being both, you know, the good person right here, right now, but also being allowed to be the bad person from the past and then
Okay.
gradually bringing those two together. So, you know, I don't want to, it's much more than being nice
Yes.
and to
Or
be,
kind.
and sometimes it's just about being really real, I think gets underutilized. And you know, you've worked, I know, with people in the prison system, and you know, I haven't, but I've learned just from hearing people from them that sometimes the most calming thing for people is just to make contact the way people in forensics sometimes can, and just let people feel that you're really present with them. You're not going through, you know, and just I'm so nice and this is safe and everything's going to be great here, but going, you know, that this is as good as it gets, and I'm right here with you, and you know that. But neither of us are perfect people, and we're gonna just slog through whatever we have here.
Mm. Yeah, that's a lovely point. I can't remember where I read it recently. It might have been in a presentation that I joined online about Dan Siegel having a phrase about the importance of feeling felt as well, you know, so
Yeah,
there's the felt sense of safety, but also maybe, you know, saying something that a person believes is quite shocking, and it is, you know, it's quite traumatic, and maybe they've told other people before and had horrible reactions to it, or just that the person in front of them with them listens and hears it and accepts it and is kind of validating, but also themselves. Is authenticity important in the therapy room?
Yes, and in a way, I've been thinking because it's a natural evolution of me and that I started, and I'm still very, very interested in committing to working with people and
Mm.
learning new ways of working with people. But I'm also on the more social level
Hmm.
thinking about it. Since I was thinking doing this interview of the last book I read by an Irish writer, which was Sally Rooney,
Oh,
and
yeah.
the and when the two characters, Eileen and Alice, I think they write letters back and forth in there. Why are we talking about literature when the world is falling apart?
Yeah.
And I think about that a lot in the last year as I'm on social media and we're discussing psychoanalytic theory or trauma
Mm.
therapy, um, the newest advances. And when I think about feeling felt, I think about all the people in our world that don't feel felt.
Mm.
And what the pandemic has shown is just a deluge of people seeking therapy because the pandemic started um, and everybody got locked down. So no one was feeling felt because you can't really feel felt. Even on Zoom, even though we're
Yeah.
feeling one another, there's a bit of a lag. And and now we're seeing what comes of people not feeling felt. They feel very alienated and very alone,
Mm.
and and grossly exceed the capacity of therapists. All
Yeah.
my therapist friends are burning out themselves. They're just the demand has been unprecedented. So, as much as what I do as a therapist, I use my training and I think I'm good at how, my people tell me that they feel felt by me.
Mm.
But they also tell me how unfelt they feel in their day-to-day lives.
Wow. Mm.
I think the larger question for our society is how do we create a world where people do feel felt and
Yeah.
don't feel excluded and people don't get lost.
I agree with you. I mean, often what I say in this sort of work or trying to bring this information to people is that we all have a role to play in it. We can't all be waiting for Harry Zeit to work his magic because there's not enough.
Yeah.
There's only so many hours in the day and it's expensive. It takes time, whereas there's lots of us out there and we can maybe do a little bit more for and with one another to be a little bit more present if we know the importance of it. So I
Yeah.
love that you made that point, even though it mightn't be quite what you were saying either. But I do think if a lot of people are in pain, then something needs to give. And it can't necessarily be more therapists or more therapeutic modalities or more research. There's something in the social, as you suggest. We might turn now to yoga and meditation for a little while, because that's another thing that, certainly I have found as one of the massive antidotes to my frozen energy and stuckness has been yoga of various kinds. So how did you get into it yourself?
I started in my mid 30s, and I think just based on my own history and realizing now how much intergenerational trauma came through my grandparents' generation in Eastern Europe, um, that as emergency medicine, progressed, and I I was struggling to regulate and even going to the gym or playing some sports. And I came to first a stretch class, and that helped. And then a yoga studio had opened up, and somebody, and they said you should go there. And it felt a bit like coming home to myself. And I really felt comfortable with it. And it's sort of followed up on my earlier wilder days. I thought like a lot of the people coming to yoga like weren't coming out of sheltered lives, that they were learning healthier ways of coping and ways of deepening their connection. And that's so towards the end when I was really tired and really burned out, I was just going, and I don't know why I went. Sometimes the classes were hard. I wasn't really a natural like some people. I would fall asleep meditating, working shift work in the ER takes its toll. And I honestly have never been a great meditator, but I think, yoga really sets you up for being quiet in the mind. And so um, it became a big part of my life for probably close to 20 years. I've come back to it a little um, now in the last year. But
do you have a preferred type of yoga, or is it more the pranayama and the breath kind of focus? Because I know that there are different schools of thought on yoga practice, and just for myself in my very new entry into this world, I do a load, and for me, hot yoga in particular is brilliant for sleep, but then it's not necessarily the most contemplative, and yin can be nice for the slower postures. So I'm just wondering, do you have a preferred kind yourself?
so I started through more classical hatha
Okay.
yoga, and I was never a hot yoga person.
Mm-hmm.
But it was asana practice,
Mm-hmm.
and 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 that took me into some pranayama
Yeah.
and so forth. My only concern, and it comes up, my partner, who also is a yoga teacher, and we teach sometimes together. And one of my main um, teaching co-facilitators who comes out of the military is also a yoga teacher.
Oh, wow.
Their pet peeve is that the people that do hot yoga, they don't go and they do the relaxation at the end, because whatever type of yoga you're doing, and I went through a yin phase,
Yeah.
maybe a very brief kundalini phase. If you don't do the shavasana, the lying down for the 10 or 15 minutes at the end, you don't get that benefit of the nervous system reorganizing itself. So
Yeah.
fortunately, I like that part. I know
I
some
love
people
it
say,
too.
oh, yeah,
I do love it too, but I see it at the beginning. Most people rush out of the hot yoga room
yeah,
because they've barely managed to stay standing if they're new. But certainly that's a lovely feeling if you've exerted yourself a bit and then you just feel a bit calmer and you're more in tune with your breath as well.
mhm,
So anything I think that increases our awareness of just our bodies and our breath is a positive for people.
absolutely.
And from your experience or that of your partner and other yoga teachers and practitioners, what do you find the main benefits of a regular practice are for people?
The brilliant thing about yoga is you don't have to think about it. That it's very natural. You go to therapy and you really, it's expected you need to be reflective. You
Yeah.
need to do these complicated things like learn to mentalize. But for yoga, you basically just have to show up and do the practice and do it over and over again, and things happen. And there's even research on it that, sort of short-term changes and then long-term changes in consciousness that have been done in places like Institute of Noetic Sciences, where they've looked at long-term people doing Eastern practices. So, it's very magical, but
Mm.
it does, for instance, we know one of the big triggers for intrusions and PTSD is not what's out there. An even bigger thing is the body. So, for instance, I worked with somebody and they were doing trapeze work and they couldn't figure out why. Um, and they had a lot of trauma in the past. They
Mm.
were in one position and they always freak out and be sick for like 3 or 4 days. And we
Wow.
realized it was the same position that was associated with trauma. So, one thing yoga does is it puts you in all these different positions
Mm.
and you associate all of them with being in the class and being safe and being okay. So it's kind of, it's not taking the minds out of the minefield, but it's putting in a lot of anti-minds. So you have a lot of good places where you can land, and eventually the good places start to outnumber the bad places.
Yeah.
Yeah.
Wow, it is fascinating. This guy called Jeff, who I interviewed about prison yoga, was telling me about a chap who was afraid of the crow position. Um,
Yeah.
but he had learned the skills to just say, this is not for me right now, and eventually practiced it and came back and was able to do it. And it was a lovely example again of being able to find a safety in the body, and with a bit of a knowledge and awareness that that was actually in the past and this is here and now. So it's amazing giving people tools, I think, to empower them in the here and now, whatever it is. It mightn't be meditation, it mightn't be yoga, but finding what works for people is really important. And this brings us to self-care, because it's something that I hear an awful lot about, and it is hugely important. People talk about self-care, particularly if they work in challenging fields like social work or psychiatry or frontline medicine, but also for parents. Like, I think as a mom, it's important that I mind myself so I can be as, present and positive with my kids and husband as I can. Do you think within the field, within medicine, let's say now, because of your own experience and because of COVID, are people aware enough of the importance of self-care, or do they even have the bandwidth to try and do it? Is it supported enough, Harry? There's about a million questions in there.
Yes.
Sorry.
And I have a million thoughts
Yeah.
because, it's been a bit of a side gig, which has an interesting history. And that the thing I've learned is systems like medicine, they give a little bit. And in a way, they endure because they can. Probably the military is the same.
Yeah.
We will give you half a meter so you don't make us go 10
Yeah.
meters. As well, you had mentioned with Adam, the inverse care law he brought up, and that really spoke to me because I saw that a lot in medicine, and probably the same in parenting and in social work. The people that need it the most are not the ones that show up.
Mm.
When Irina, my partner, and I were doing self-care workshops for doctors for many years, the people that showed up were the people that are already had a yoga practice or a meditation practice, or were quite self-aware, whereas there were a group of people that were very cut off and numbed out and disconnected, and they were not showing up. So,
Mhm.
again, it's not one size fits all.
Yeah.
And it's hard to sometimes know, because self-care can be evasive, especially when you have a trauma history, because we can, and this occurs a lot in the more psychiatric end of things. What we're really caring for is our well-functioning part.
Right.
And we take that part and we build it up and build it up. And then all the hurt parts and exiled parts are just further down and they get ignored. And and it's hard to know. Someone asked me once in an interview, well, would you take, a hotshot cardiovascular surgeon and, start doing inner child work with him? And,
We
you know,
might well need it.
he might well need it.
Yeah.
And, the question is, you don't know until you know a lot of the time. I
Yeah.
could sit and assess somebody and then get to know them and get to know how close they are. And maybe we wouldn't need to do that work. But I would also see the people that, yes, it's going to catch up with you. I mean, one of the problems with doing that more superficial self-care, and often I find that people that, they like in medicine, the system offers a lot of mindfulness videos,
Right.
but
Yeah.
people aren't being trained and they're dissociating, they're not being mindful. And so they're kind of a little numbed out, but then it's their families that get impacted, and
Yes.
their children then show up quite distressed in therapy because their parents weren't present So the parents might have been feeling okay. It's like, I'm working all the time. I'm very focused on my work. They keep so busy that even their self-care is busy. It's
Yes.
like I have an hour to yoga and then back to work, and and I don't do the shavasana at the end because it would be unbearable to actually slow down and be myself. So self-care is important. I would love to see our self-care expanded,
Hmm.
and to understand that we tend to be moving in the direction of very personalized self-care. And, as the Dalai Lama says, of all
Yeah.
the principles of Buddhism, community is the most
Mm.
important. So I think in medicine, my heartbreak has been to see how hard it is to form community. And when community forms, it's usually on social media.
Yeah.
And so, for instance, for self-care, you might see doctors creating a private page where they can vent,
Hmm.
and and there's a lot of closeness, but in a way it's developing habits that become sort of procedural, what in yoga they call samskaras. Like you
Okay.
begin to groove into, okay, my self-care is I log on to Facebook and I vent, and other people hear my vent,
Yeah.
and it will get me here, but it can also get me stuck here. And
Yeah.
what would the next step be? And how could I sort of fluidly move into something more creative or more
Hmm.
life enhancing?
Yeah, one of the things I was thinking about there as you were sharing, Harry, was for me, some of the fascinating stuff is around the ancient kind of indigenous healing practices of dancing in groups or rhythmic drumming and things like this. Now, obviously, not all the medics who are a bit numbed out and maybe disconnected and dissociated are going to join a drumming group or a communal dance party, but there's a lot that we've kind of forgotten as well, in terms of what's good for us or what will just again get the joyful energy flowing. So rather than logging on to the mindfulness app or again, sometimes we just need to disconnect from the internet and be more in the real world or out in nature as well. I think sometimes for me, being in the woods can be a glorious, replenishing experience. So, or fishing for some people, I think can be really, really calming and connecting. So it does though take time to think about what might work for me and trying a few things as well and not just being so kind of again top down judgmental about, oh, that's a bit dippy hippie maybe for me.
I agree. And unfortunately, it seems so simple. And I just, I came from a retreat where I did that with, but it was very poorly attended. There were 13 of us, and we had intimate discussions, and we hiked in nature and had a forest bathing leader, and we did
Sounds
improv
gorgeous.
and did some drumming, and also had a very special one of the people that came had learned this acupuncture protocol called the Nada protocol, which very impressed me because you sit together in a group for 35 minutes and it quiets down the sympathetic nervous system. And once we had
Cool.
that done, we actually were that really opened the group. So it's doable, but the system somehow doesn't support that. But I agree. And, I think of some of the great work done with veterans, name escapes my um, memory right now, that I met at a conference, who takes Vietnam veterans. First, he took them to Greece to do the dream incubation at the Epidaurus, the ancient Asclepian temples, and they
Wow.
would sleep in the rooms and have healing dreams. And now takes them to Vietnam, and they write poetry, and they meet some of
Mhm.
the people that fought on the other side. And those kind of things that become archetypal and experiential and
Yeah.
take you right out of your life into another place are so powerful ways of healing trauma.
Yeah, sounds amazing, both of them. Can you tell me a little bit as well about your creating safety groups? Maybe that was one of those, one of the retreats there. But what actually are creating safety groups?
Well, we created them to teach primarily at a body level and at a relational level in a group that could come together what it is to feel safe in the body. So it draws a lot on yoga and on sensorimotor psychotherapy. And the initial work is a 9-week protocol where we just go through things like grounding and breath work. There's a lot of polyvagal in it. So
Mhm.
people recognize when they're dysregulated and hence feeling unsafe and how to bring themselves back for safety. And then once people did that group, then they could go on and stay in the group and literally like bring whatever issues they had to the group and we could process and use those principles.
Mhm.
So I have some thoughts, and I did do work with a group of ER physicians in the first year of the pandemic, and we didn't do it quite the same way, but we did 10 or 15 minutes of
Mhm.
somatic work, just learning something quick and dirty that they could do to calm their body, and
Yeah.
and then from there they would just go and they would share and draw on their own strength, and it was actually quite beautiful. Hard to
Yeah.
get everyone together at the same time, but it seemed to work. So
Very good.
that's what they are. Yes.
Yeah, thanks for telling me because I think the idea again of safety in one's own body, but also safety in groups now, because I don't know if this is something you've noticed as well, either, among clients or just friends or family members, that COVID has had an impact in how we are around each other as well. Like, regardless of a pre-existing trauma history, if people have health issues or they've a sick elderly person, just the kind of ease that they might have enjoyed before has, I think, not quite gone, but it's kind of not quite there yet either in terms of going back to normal. So I'm just again wondering, say, for the highly stressed out frontline workers, could these type of initiatives be done online to fit in with a busy schedule, or is it better to be in the room together ideally?
Well, it's better to be in the room, ideally, but I online has its benefits. But even for doctors to do something that's consistent becomes so challenging.
Hmm.
And I'm disappointed in the medical system in that way in Canada because I think it's different in the UK. And I
Mm.
think in Canada we're you know, we we're a little bit more insulated and but trauma's coming our way and but we're a little bit less experimental and adventurous as well. And but there's such pressure by our physician care organizations to put people one in one on the room and keep everything rather hidden. And I
Hmm.
think that creates shame and
Yeah.
stigma, even though and that's their own trauma split. They can
Mm.
say, we're against shame and stigma, but then rather
Yeah.
than put people in groups and bring up this awareness of how isolated we've come, they keep us alone. So
Mm.
I I think so many great therapists, I think of like Scott Peck and but many, many others come late in their life to realize that we undervalue community and we undervalue group work and its
Yeah.
potential. So, I maybe there's not a lot of research dollars there, but my own experience in group is it very powerful. And especially when you bring in the body
Hmm.
and the the power of relationships, so much healing can be done
Yeah.
and more efficiently because for me to work with one person with complex trauma and see them for years and years um, alone in a room is very different than what could be accomplished in group. But unfortunately, our system makes it a lot easier to do that individual work.
Mm. such an important point again. I actually saw Fritzi Horseman and the Compassion Prison Project work with a group of women in Edinburgh
Mhm.
prison, and it was a beautiful thing to witness because I was only there for the second day, but there was an exercise called The Gold I See in You that we all went through, and everyone had to say something nice and positive about, I think it was three women who stood in the center, and they almost like grew energetically. They were taller and kind of their faces were more uplifted by the end. It was so interesting. And I was thinking, wow, this is beautiful because they might never have heard these type of things before. And even if you had negative history or you didn't know them like I didn't, you still could find something nice to say. But what if we had these type of practices in our workplaces as well, because people again in the health services are doing tremendous difficult work and not always getting any little thanks or a bit of credit, and again have stuff going on in their own lives. So the healing occurring in community, that's what Fritzi says, that we heal in community,
Mm.
makes an awful lot of sense
Yeah.
to me. But again, the systems need to support it. But then again, we are the systems as well. So if enough of us come together, maybe to demand change, perhaps,
Well,
maybe
that's the plan. Yeah.
it might. And just for
Yeah.
my final question, when we're talking about the system and politics and how we can advocate for change, what would you say, Harry, politicians and policymakers can do, I suppose, to promote safety, equity, and connection in childhood so that everyone can have an equal opportunity to grow up to become a flourishing adult? It's a massive question, but one I like to ask everyone.
Yes. And I want to ask my fellow Ontario, Canada, Ruth Lanius,
Yeah.
who I'd met a few times over the years, and she answered so well because it's really, I've said it from the get-go, and I think we all know it in this work. It's to support families from the moment of conception to the early years of life,
Hmm.
and especially in Canada and probably United States, we're so invested in the nuclear family.
Hmm.
And it doesn't work. It just puts people in competition with other people. And it leaves a lot of people behind. Remember years ago, I was at a psychoanalytic lecture, and a man from India put up his hand, and he's very angry, and he said, "This is your individualized treatments and your culture.
Hmm.
We in India, we used to have communities and everyone pulled together and everyone took care of one another. And now we're just like you, and all we
Yeah.
care about is our own little unit." And I cannot see that as ever serving us. And I think more and more as we see, the haves and have-nots, whatever it is in terms of social resources, financial resources, it's not sustainable.
Hmm.
So final word, I think of, I remember reading an interview with Kate Atkinson after I read Life After Life, and she talked about how in her reflections on, if we go to Great Britain, that the people were at their best during the Blitz, that people
Right.
came together because they had to come together. And I
Hmm.
mean, she's saying it not in a romanticized way. She's not saying everything was perfect. And now we've had the lockdown, which was the
Mm.
opposite. You know, we had a common enemy,
Yeah.
which in this case, but a much less clear path and a lot more divisiveness in that. But people were pulled apart. And, I think, that wisdom that we're at our best when we're together. And I'm very scared that it might be in some government agendas to keep us divided in
Mm.
that. But, as human beings, I think we all need to reflect on how we can become more of a collective where every voice is heard How can our action become more collective?
Hmm.
How can our voices become more collective?
Thank you, Harry. That's a beautiful place to end, really. And I couldn't agree more. I think we'll all be better off if we see our interconnectedness and our
Mm.
rights and responsibilities towards one another, and the joy that we can get from being more connected, you know,
Yeah, yeah.
not just hanging around with the same type of people all the time as well, you know.
No,
Um,
yeah. All our different minds, hearts, and bodies,
that's it.
finding common ground. Yeah.
Yeah, that's exactly it. Well, look, thank you so much. I'm Jane Mulcahy. This has been Relationships Matter with me and Harry Zeit. I hope you enjoyed the conversation. I certainly did. Thanks for tuning in, and thanks again, Harry.
Thanks for having me. It's been a pleasure.